Hey everyone, welcome back to Healthcare Hustle, where we show you how to build a high-paying, flexible healthcare career outside of traditional bedside nursing. Today, we're diving into a job that can pay $150 an hour or more, and almost nobody knows about it. A life care plan is a comprehensive document that outlines all the future healthcare needs, services, equipment. If someone has a spinal cord injury, a traumatic brain injury, or a progressive condition like ALS, they may need surgeries, therapies, specialized equipment, home modifications, and personal care for decades. They review medical records, talk to treating providers, assess the person's condition, and research the local costs of care. They put all of this information together in a detailed report called a life care plan that outlines what the person will need, from medications and therapy to equipment like wheelchairs, lifts, and hospital beds. What they all have in common is direct, hands-on experience caring for patients with complex medical needs, so they understand what a person will truly require to have the best possible quality of life. Certified life care planners can charge anywhere from $125 to $300 per hour, depending on their experience and credentials. You decide to become a life care planner. You land your first case through a referral from a lawyer you connected with at a professional networking event. You spend 30 hours reviewing the patient's records, interviewing their care team, researching costs, and writing the report. You bill $150 an hour, earning $4,500 for that single case. And you did almost all of it from your home office. Organizations like the International Commission on Healthcare Certification, ICHCC, and the American Association of Nurse Life Care Planners, AANLCP, offer reputable programs. Many average around $150 to $200 an hour. And service providers to get up-to-date pricing on everything from specialized wheelchairs to in-home nursing care. Many cases settle before trial, and the life care plan itself is used as evidence during settlement negotiations. Workers' compensation carriers, hospital case management teams, rehabilitation firms, or even directly with families who need help understanding future care needs after a catastrophic injury. You'll review the medical records, interview the patient and sometimes their family, speak with their treating providers, and conduct an in-person or virtual assessment. You're often dealing with tragic situations: a child injured in a car crash, a young adult with a brain injury, or a worker who lost mobility after an accident. It can be heartbreaking. There's also the pressure of tight deadlines, especially if a case is going to mediation or trial soon. Your reports need to be clear, thorough, and able to stand up to cross-examination. You've spent years building knowledge that can change lives and secure futures. Life care planning is one of the best-kept secrets in healthcare, but it doesn't have to stay that way. If you're not detail-oriented or comfortable defending your work, this might not be the right fit. Then you research costs, gather supporting documentation, and write a detailed, organized plan, sometimes up to 100 pages, outlining everything the individual will need, and make a real difference for people at one of the hardest times in their lives. Reach out to a few life care planners on LinkedIn for informational interviews and consider taking a course on medical cost projections or case management to build your foundation. Start networking with local attorneys, especially personal injury lawyers, since they're often the ones referring cases. Many life care planners say this career lets them continue helping patients, but in a way that is less physically demanding and far more flexible than bedside care. Finally, you deliver the report and answer any follow-up questions. And drop a comment if you'd like a step-by-step video on becoming a certified life care planner. Remember, your skills are worth more than you think, and there is a whole world of opportunities waiting for you. See you in the next video, but sometimes you may be asked to testify as an expert witness to explain and defend your findings. This can be nerve-wracking but also very lucrative, with testimony rates often ranging from $200 to $400 an hour. They need to know how to justify these costs in a report that can withstand scrutiny in court. It's not unusual for a single life care plan to pay $3,000 to $10,000, depending on the complexity of the case and whether you testify in court. These include spinal cord injuries, traumatic brain injuries, amputations, birth injuries, severe burns, chronic pain, multiple trauma, or degenerative diseases like multiple sclerosis or Parkinson's. In each case, the life care planner evaluates the individual's unique situation and develops a plan customized to their needs. And because each plan typically takes 20 to 40 hours to complete, you can do this work part-time and still earn an impressive income. But lawyers, judges, and insurance adjusters don't have the medical knowledge to figure out what those needs will be or how much the lines cost. And it factors in the expected lifespan of the individual, projecting the total costs over decades, adjusted for inflation. Many life care planners combine this work with other services like case management, medical cost projections, or expert witness testimony to diversify their income streams even further. This plan becomes a critical document in negotiations, settlements, or trials. That's where life care planners come in. First, you'll need clinical experience in nursing, therapy, or a related field. Most certifications require at least a few years of hands-on patient care. Next, you'll need to complete a life care planning certification course. The most recognized credentials are the Certified Life Care Planner (CLCP) and the Certified Nurse Life Care Planner (CNLCP). These certifications show lawyers and insurance companies that you have the expertise to create defensible, professional plans. And associated costs for someone who's experienced a serious injury, chronic illness, or disability. It's often used in legal cases like personal injury lawsuits, medical malpractice, or workers' compensation to determine what someone will need for the rest of their life and how much it will cost. It's called life care planning, and if you're a nurse, therapist, or healthcare professional, this could be your ticket to serious income, flexibility, and making a huge difference. First, let's talk about what life care planning actually is. Now, why is this important? Life care planners are healthcare professionals who specialize in evaluating the medical and functional needs of someone with a catastrophic injury or illness. The plan also includes projected costs for things like home renovations, for example, widening doorways, adding ramps, or installing accessible bathrooms, as well as transportation needs like modified vehicles. But who can become a life care planner? Typically, these are experienced healthcare professionals like registered nurses, occupational therapists, physical therapists, and sometimes vocational rehab specialists. One of the best things about life care planning is the pay. Imagine this. You're a nurse who's burned out working 12-hour hospital shifts, missing time with your family, and dreading every alarm bell. You can choose to take on one case a month or build a full-time consulting practice, depending on your goals. So how do you actually get into life care planning? Training for these certifications typically takes several months and includes coursework in medical, legal, and financial aspects of life care planning, along with hands-on assignments like writing sample plans. Another key piece is understanding medical cost research. Life care planners spend a lot of time calling suppliers, vendors. Speaking of court, do you have to testify as a life care planner? Not always. Who actually hires life care planners? The main clients are personal injury attorneys who need a detailed plan to support their case, but you can also work with insurance companies. You might be surprised to learn how many types of cases need life care plans. What's the process like for a typical case? It often starts when a lawyer contacts you with a new client. Let's talk about challenges. Life care planning can be emotionally intense, but the benefits are huge. You get to work independently, set your own schedule, use your healthcare skills in a fresh way. If you're interested in getting started, I'd recommend these steps. Research CLCP or CNLCP programs. Remember, your clinical experience is incredibly valuable outside of the bedside. Thanks for watching Healthcare Hustle. If you found this helpful, smash that like button, subscribe for more high-paying, flexible healthcare career ideas.